Welcome to the demo for Open Dental software. Today we'll be going through the patient's flow through the practice, along with some other features in the software. We'll start by going to the Select Patient button in the top left-hand corner and searching the patient in the system to make sure we haven't already added them in the past. Once we've done a quick search using the search features on the right-hand side, you'll see the Select Patient area is blank, that I haven't added Mary in before. I'll then be able to add Mary into the system with the Add PT button for just one patient, or the Add Many. Add Many allows you to add up to 5 family members at a time. This can be useful for larger families. It can also be useful if Mary is going to be your patient, where John, her husband, is the insurance carrier. We'll put in the details for John, and then mark him as a non-patient in the system, as we only need him for insurance purposes. Let's go back to the previous screen, and we'll just add Mary in for now. That Add PT button at the bottom, and then we'll click on the details to be able to get Mary added into the system. You don't need slashes and dashes, as Open Dental will put those in automatically for you. Let's put in a little information to be able to contact Mary. You can choose preferred method of contact. You can choose the preferred way that they want to confirm appointments. And you can choose how they receive their recall reminders for being due or past due for their cleaning appointments. Our zip code feature makes it so that if you've already typed in the zip code in the past, you can use that for future patients by typing in the zip code, tabbing out, and Open Dental will input the city and state information for you. You can choose the patient's primary provider, as well as the secondary provider if there's a hygienist that you want this patient assigned to. Click Save when you're ready to add the patient into the system. You'll notice at the top it shows the program's name, who's currently signed into the software, and Mary to show that we're actively in Mary Thorpe's chart. Let's go ahead and add an appointment for Mary. You can do this by simply finding the date on your calendar to schedule the appointment, going to the time in the operatory that you want to schedule the appointment, and double-clicking. It'll verify that you're trying to schedule a Mary. Click OK. And you can set up appointment types if you want Open Dental to have pre-templated appointments with certain procedures attached. You can also choose None to bypass the appointment type and completely customize the appointment yourself. The single click on item section in the middle is completely customizable by your office. Line items like this that have multiple abbreviations attached are going to automatically post multiple procedure codes with one click. You can also use the Add button at the top of the appointment window if you want to pull up a full list of ADA codes to choose from instead. This is useful if you're trying to add in a procedure code with a specific tooth number or tooth surface. From here, I can customize the length of time for this appointment by clicking and dragging, or customize any of the center section here for more details about the appointment. For now, I'm going to put in an appointment note so I can communicate with the back any specific things my patient has told me over the phone. Click Save when you're ready to schedule the appointment. You'll see that the appointment was placed on the appointment book right where I double-clicked. If we hover over the appointment here, you can see that an appointment bubble pops up. This will give you details about that appointment without having to double-click into the appointment itself. Let's go into the appointment lists. The appointment list is where you're going to be able to build your practice. This button is right below the Select Patient button in the top left-hand corner. This will store a list of people that are due or past due for their recall appointments, or you can put in a date range to see when the recall will be coming due. A confirmations list to show you all the appointments that are on your schedule within a date range and their current confirmation status. The plan tracker will allow you to see appointments that were templated by the back office to show what doctor wants to happen next for a patient, but those appointments never got scheduled. The unscheduled list to show a short list of appointments that need to be followed up on, either because the patient missed the appointment or called to cancel and weren't able to schedule right away. The ASAP list will show a short call list of appointments where the patient has asked to come in sooner than they're currently scheduled. The radiology button will allow you to meet or help meet the EHR measures. This allows providers to quickly approve radiology orders. The Insurance Verify button is a list of insurances that need to be verified on upcoming appointments, such as the patient's eligibility for the plan and their benefits. Now let's go over how to update the status of an appointment. You'll notice in the top right-hand corner of the appointment is a circle that's currently white to show that it hasn't been called on with the patient. If you need to manually update the appointments, because you're not using a third-party service to automatically update the appointments for you, or using Open Dental's e-services, you can easily update the appointment's confirmation status by selecting on the appointment, contacting your patient, and if they confirm the appointment, you can click on the Confirmed option over on the right-hand side for confirmation statuses, or if you needed to leave a message, you can also set it to that as well. Once the patient has arrived for their appointment, to be able to track how long it took to get them back to the chair, you can click the appointment and set it to Arrived and use our waiting room feature. This will keep track of how long it has taken since you clicked on Arrived for the patient to be taken back to the chair. Once the back office sees the waiting room feature and that their patient has shown up for their appointment, they'll be able to select the appointment and click on the In Room to take the patient out of the waiting room feature. Let's go into the next module that's called the Family module on the left-hand side of your screen. This module will allow you to make edits to the patient information if you notice a mistake or need to add additional details. Simply double left-click into the patient information screen to get back into the window you saw earlier. We can add additional family members inside of the Family module by clicking on the Add button. Let's go ahead and add in John at this time. We'll click on Add, and Open Dental will pre-populate the last name, which you can still change if it is different from your patient. Let's go ahead and add in the details that we would need for the insurance. Make sure to set the status as non-patient if they're not going to be an active patient in your system and you're only entering them for insurance purposes. Click Save to add the patient in. If John needs to be the guarantor to be able to receive the bills, select him to highlight him in orange and click on the Set Guarantor button to move him up to the top of the family members list. For today's example, I'm going to leave Mary as the guarantor. If you need to move a patient out of a family because you've accidentally entered them into the incorrect family, or because the patient has come of age and needs to be in their own account, simply highlight the patient's name from the family members list and click on the Move button. It will give you two options to move them into their own family, or say no to be able to move them into a family that already exists, and it will pull up a list of all patients in your system for you to choose which family they belong in. If you need to add insurance onto the patient, simply select the patient that you're adding the insurance to, click on the Add Insurance button, and this is why it's important to make sure that the person who is the subscriber on the insurance is at least added into your system for informational purposes. You will get this message asking if the patient is the subscriber. If we say yes, it would be Mary as the subscriber. And for this scenario, I'm going to show you how to add it in when John is the subscriber, so we'll say no. We'll select John from the list of available options and click OK. We can set that Mary is the spouse by associating the relationship to the subscriber at the top left corner. The Pick From list is always a good option to start with when you're adding a patient's insurance into the system. This will tell you if you've already entered the insurance plan on a patient in your system in the past, and make sure that you're not doing extra effort. If the insurance plan already exists, simply select it and click OK. If the insurance plan is not currently in your system, click on Blank Plan and enter in the details. If you select a plan that already exists, once you select it and click OK, Open Dental will populate the details that you've entered for a prior patient. Simply put in the subscriber ID details and any details specific to that patient, and click on Save. You'll note that the insurance is now attached to Mary, and the subscriber information shows John Thorpe. If the patient does not have insurance and your office offers a discount plan or membership plan instead, you can set up the discount membership plan inside of Open Dental and attach that to the patient instead. Inside the Family module, you can also adjust the patient's specific recall in the top right-hand corner. We'll go over that in a little bit. Now that we have the insurance on the patient, let's go into the Chart module. You'll notice in the top left corner, we have a comprehensive tooth chart. Below that is a drag bar that eventually over time will have multiple ticks as your patients come in for visits. This will keep track of the patient's progress in their mouth over time. Below that, you have a box available for conversation starters and things you want to be able to remember when the patient comes in for their appointment. The patient information section is just below that. And in the pink area that you see here is where you're going to be searching or adding in additional information for their medical chart. Let's double click into here to show you how to add things in. Once we've double clicked into the pink area, the box for their medical will open. There's a couple of fun features inside this area. If I put anything inside the medical urgent area, or if I check the box for pre-medicate and save this window, there is a way to add these two fields as viewable options in the appointment view so that your front desk staff is communicated with. You'll see here it's on the appointment for severe latex allergy of the medical urgent note, and the appointment's also marked as pre-medicate, along with that information also showing up in the appointment bubble. Let's head back to the chart. Other information that can be added quickly is the service note section. You will also have the option to right-click, insert quick paste notes, which are things that you commonly have to type out for the patient when it comes to their service notes area. The medical summary area, and your medical history complete and detailed. To add problems onto the patient, simply go to the Problems tab, Add Problem, select one, or hold down Control to be able to select more than one problem the patient has from your list. And if you don't see the problem in your list, simply add it to make it available for the next patient as well. Click OK to add the problems onto the patient's medical chart. Medications, and add medication to the patient. Click OK and put in any details that pertain to that patient. Hit Save to add it onto their medical chart. Any allergies? Let's make sure we get that latex allergy added onto the patient, along with any reaction description and the date of their last adverse reaction. We also had a vital signs tab if you want them to be stored in the medical chart instead of in the progress notes area. Click on Save to save the information into the pink area in the lower left-hand corner. Now I'd like to direct your attention over to the right-hand side in the progress notes field. You'll notice we have today's appointment, which shows in the bright yellow color. All the procedures that are currently expected to be done during the appointment today are also showing in the bright yellow below it. Let's go over how to add more information to this progress note section. We'll start under some of the tabs that are available to be able to do movements on the tooth chart, as well as the Enter Treatment tab next. Under the Missing tab, let's go ahead and mark any teeth that are already missing inside the patient's mouth. Simply select the tooth number and click on the Missing button. If you need to mark a tooth as missing, but you don't want to propose treatment on it in the future, simply select that tooth number and mark it as hidden instead, which will remove the tooth number itself. You can mark the mouth as edentulous, set specific teeth to primary teeth, set all to primary, mixed dentition, or permanent. In the Movements tab, we can select one or multiple teeth that have the same movements, and use our buttons to be able to reduce and show that we have an unerupted tooth or teeth. Let's grab one more tooth and show an unerupted mesial impaction. If you'd prefer not to use the buttons, you can type into these boxes and then click Apply instead. Let's go ahead and do some slight rotations to show that we've got some impacted teeth on tooth number 1. Let's head back into the Enter Treatment section just to put a few things on the treatment plan before we go into the other tabs at the top. In the Enter Treatment section, we'll go into our Existing Other to show that work was done on tooth number 30. We'll grab tooth 30, Existing Other for status, and then choose from our quick buttons over here on the right for an MOD posterior composite. With 3 quick clicks, I was able to chart the procedure code into the progress note section, showing the work was done outside of our practice. If you want to be able to see specific things that happened on certain teeth, you can select those specific teeth, go to your Show tab, and click on the Select Teeth option. This will narrow down the results of any treatment that has been done on any specific teeth. You can also use the Show tab to be able to customize what you're seeing inside of the Progress Note section. So as an example, if I only want to see appointments the patient has had, I can even choose None and click on the Appointments checkbox just to see appointments they've had in the past, or ones that are coming up in the future. You can also use the Show tab to look up keywords. So if you need to see the last time that the patient had a prophy or bite wings done, you can simply type in the word and Open Dental will populate any results it has for the keyword. The search feature can also be used for specific procedure codes as well. You can customize views so that everyone in the office has access to specific views. These are a global setting, so everyone needs to agree on what chart views are being created. In the Draw tab, we can use the pen to be able to draw on things such as lingual bars, cracks on teeth, abscesses on the teeth, or supernumerary teeth. You can also use the text feature here with the Add button to put in text specific to that patient. As an example, if I want to use SN to indicate the patient has a supernumerary teeth in a certain location, I can click OK, grab the SN text that was just created in the upper left, and drag it to where that supernumerary tooth exists on the tooth chart. We also have an ortho chart feature in here for those specialty offices that want to be able to use the Palmer dentition and being able to put in hardware in the patient's mouth. Let's go back to Enter Treatment, grab tooth number 9, our condition, and we can even use a diagnosis if we want to indicate why we're watching the tooth. Let's go into the Procedure List button right here and find our watch. It puts a W above the tooth on tooth number 9, and we can see that crack diagnosis right on the line item with it. If I need to refer out procedures, I can click on our tooth, our referred, and I can go ahead and pull up my procedure list again. Select my procedure from the list of ADA codes, and if you don't know the code, you can also use the category section here, such as oral surgery, and finding the code within the list. Click OK, and Open Dental will put the referral inside the Progress Note section. You can also attach who you're referring to by double-clicking, clicking on the ... next to the referral, and choosing who you're referring to. Now let's go over treatment planning some procedures. I'm going to select tooth 32 and 17, as well as our entry status of treatment plan. This time I'm going to use the Type the Procedure code because I already know which procedure code I'm going to chart. Now I've treatment planned the extraction on those 2 teeth. Let's go ahead and grab our 12, 13, 14, go into our General tab, and use one of the procedure codes that are in our system for our bridge. And then we'll go ahead and select specific teeth of different types to be able to show you what happens when I choose the RCT option. you'll see that Open Dental has automatically taken a look at what type of teeth I've charted on and put the corresponding code for that specific type of tooth. Now that we have some procedures treatment planned, let's go into how to prioritize them. You can prioritize them inside the chart module by selecting the treatment plan checkbox. From here, we can select the procedures that need to happen next and set their priority to 1. The next procedures we're expecting to do for the patient, and 2, and our endodontic treatment with 3. Now that we have the procedure codes treatment planned and also prioritized, we can easily put them onto a templated appointment so that if the front desk is the one doing the scheduling, they automatically know which appointment to schedule first. Under the Planned Appointments tab, we can click Add. We'll bypass the appointment type since we know exactly what needs to go onto the appointment. And then we can go ahead and highlight our priority number 1. We can put any specific provider that's going to be doing that work. We can customize the length of time it's going to take, and we can put any kind of appointment notes. We'll go ahead and click Save, and we've created the first planned appointment for the patient. Additional planned appointments are as simple as clicking Add and following those same steps again. Now let's go ahead and go back to our treatment plan by unchecking the treatment plans box. Let's go ahead and set the appointment complete for today. Once again, all procedures that are going to be completed automatically when the appointment gets set complete are what are highlighted in the yellow color listed here. If your staff ended up not doing a specific procedure today, simply find the appointment line item, double-click, and make sure to single-click to detach any procedures that are not going to be completed today. Click Save, and you can complete that appointment line item by right-clicking and setting it to complete. To do notes on a specific procedure, you can double-click into the procedure and freehand type your notes, or use the auto note function to use templated notes in your system along with any prompts that you want to create. Another option for progress notes in Open Dental is to highlight any procedures done by a provider, right-click, and create a group note. This will create one note attached to any procedures that provider completed today. Let's show you the Auto Note feature now. We'll click on Auto Note, choose our Auto Note for the comp exam, and insert. This is an option for being able to select multiple medications the patient is taking, and allergies are the same with a multiple select box. This is a prompt for being able to type into the box. We can skip prompts, you could remove prompts, or you can remove the prompts once you've finished up all of your notes and being able to remove anything that doesn't belong in the note when you save it. Click Save to add the note to the group note. From here, we can go ahead and electronically sign it with a mouse, or if you have Topaz signature pads connected to your station, you can click the pen icon to sign with the Topaz. Let's show you what the electronic signature does. It will electronically sign it based on the user that signed into the computer, or if you need to change it to a different user, simply click the ... sign in under your specific user, and then click the E to sign it. We'll save to save the group note that's now attached to that provider's procedures. Other features inside of the chart module include being able to print the progress notes, creating a prescription in Open Dental with the new Rx button, choosing the prescription that you're prescribing for the patient, or clicking on blank to add in a new prescription. Click OK, put in the details on the prescription for your patient, and print off patient instructions and printing the prescription at the bottom. These will add into the progress notes so that you can see what's been prescribed to the patient from inside the chart. You can also see any prescriptions that you've prescribed for the patient inside their medical section as well. The ERX button is if your office wants to use electronic prescriptions using either DoseSpot or NewCrop. The Lab Cases button allows you to create lab cases that can be attached to the appointments that they're going to be needed for. The Perio Chart button is going to allow you to open up the Perio Chart, which is going to look something like this. We also have the Ortho Chart, which is going to allow you to customize a specific ortho chart for your patient. The Consent button will allow you to print consent forms. The Tooth Chart will let you print off a copy of the tooth chart for the patient, or you can use the drop-down arrow to show a bigger version of the tooth chart if you're trying to explain treatment to the patient. We have exam sheets in Open Dental, CCDs, and you can even customize the layout of your chart module. Now that we've gone over the chart module, let's go into the treatment plan module on the left. If you prefer to prioritize treatment from the treatment plan module, it's just as easy as it was inside the chart module. Simply select the treatment that you want to prioritize, set it to number 1, find the next treatment that you want to do, set it to 2, and your very last option, N3. We now have prioritized treatment to present off to the patient. If you're trying to present one option at a time to the patient, simply highlight it and save the treatment plan. If you want to print off the entire thing for the patient, you can leave the entire treatment plan available and click the print button up at the top, or create an emailed copy to be able to send off to the patient from inside of Open Dental. If you want to save a copy of everything you've presented to the patient and have them sign for it, click on the Save TP button. It will create a saved copy, and then you can click the Sign TP to have your patient sign for the treatment you've presented for them. This will give you a graphic of the tooth chart, what you're presenting to the patient, as well as any insurance benefit information at the bottom of the page. There's also a spot for your patient to sign, as well as the practice. Once it's been signed for, it will be indicated as being signed in the treatment plan module. Earlier, we indicated that this needed to have a pre-auth sent for it, and we're waiting on the planned appointment being scheduled until the pre-auth comes back. Let's go ahead and create the pre-authorization. We'll highlight the procedures, click on pre-authorization in the top left-hand corner, and from here we can print, send electronically to the clearinghouse, or save to wait to send out the claim in a batch of other claims. Keep in mind, anytime Open Dental gives you a pop-up letting you know that it's missing information, it will help you throughout the program. We can still click OK to get past it, but we do recommend that you fix the information that it's asking you for. In this case, it's asking for a prosthesis, so if I double-click into the procedure code, I can go ahead and set if it's initial or replacement and save on each one of the procedures that it said was missing information. If I'd like to give the patient a specific percentage discount, I can highlight the procedures and click on the discount button to put in a specific discount. I can update the fees if we've changed insurances for the patient, create lab cases for those appointments that need the lab case attached to them in the future, print consent forms from in here, and also see patient's benefit information. Now let's go into the last module on the left, the account module. Inside the account module, if we take a look at the procedure codes, now that they've been charged out from completing the appointment, you'll see that they say unsent. This means the patient has insurance, and I can quickly highlight the procedure codes, click on the New Claim button, and once again get the options for printing, sending electronically through the clearinghouse, or save to be able to batch it out later. I have a procedure code that this insurance does not allow me to bill. We'll go ahead and take payment for this procedure code. You'll see that my patient owes the $75 at the top, so I'll select the procedure code, click our payment button, and put in the dollar amount our patient's giving us. From here, I can select the payment type, and if you're using one of the credit card processors we integrate with, you'll be able to click on the buttons at the top right to be able to charge the card. Otherwise, if you're using a credit card processing service that's outside of Open Dental, run the card as normal, and then you'll follow these steps to be able to enter in the payments and attach it to the procedures that it's for. Click Save to put in the payment details onto the ledger. You can do adjustments on the account module, send claims to secondary, medical, or tertiary and beyond, set up payment plans for both the patient and/or the insurance, attach quick procedures of things that you sell up at the front desk, such as whitening kits or toothbrushes, print out a full statement of the account, or use the dropdown to customize what type of statement the patient is asking for. More options gives you the ability to completely customize what is showing up on the statement, including a note that you may want to add onto the statement for this month's billing. You can view the statement from here and print off an email from here as well. I'll go ahead and save this to the account. Now let's go into the account module, or the appointment module, now that the appointment has been completed and our patient is checking out. If your back office staff wants to schedule the next appointment for the patient as well as the next cleaning for the patient, they can click on the Pad Appointments button to see those planned appointments that they set up earlier. Your front desk staff can also do the same thing. Plan number 1 is the next appointment that should be scheduled for the patient, so I'll select plan number 1, copy it off to the pinboard using the button at the bottom, and you can see it places it on our pinboard on the right-hand side. From here, I can use the schedule to find a date and time that works for the patient, and then click and drag the appointment onto the pinboard. If you want to be able to search by specific parameters on the pinboard, make sure your appointment's on the pinboard and click the Advanced button to be able to narrow down specific openings the patient has asked for. Let's create their next cleaning appointment as well. You'll see the appointment for today has turned gray to show that it's been completed and the procedures were charged to the account. This will also make it so that you now have a due date on the patient for when their next recall should happen and which procedure codes should be attached to the appointment if it's after a certain date. Let's click on the Make Recall button at the top. From here, I have a button to be able to schedule an entire family if you have multiple patients in the family who are all going to be due for their cleanings, or schedule a recall to just schedule the current patient that you're on's recall appointment. Once you click the Schedule Recall, the appointment will be posted to the pinboard over on the right-hand side. If that provider has a schedule in your system, Open Dental will automatically jump to the date that your patient is due for their next cleaning appointment. It will also jump the calendar forward for you 6 months. If you don't have your schedule quite set up yet to be that far out, you can still use our 3, 4, and 6-month buttons to quickly navigate to 6 months in the future or your patient's current recall interval. From here, once again, selecting a date and time and being able to see their actual due date from this window as well, click and drag the appointment onto the screen into an available operatory and choose whether or not you're changing the provider. Now that we've scheduled our patient's next couple of appointments, we've gone through the patient flow. Let's go into 2 other modules that are inside of Open Dental. The imaging module on the left-hand side is where you can go to import patient pictures if you want them to show up on the appointment and in the family module. Let me show you how to do this really quickly. We'll select the patient pictures, click on Import, or you can use the video capture to capture a picture of your patient if you have a webcam. We'll import the picture into the Patient Pictures folder, and in the Family module, we now have an image of our patient, and hovering over the appointment, we also have that image. Some other features of the imaging module allow you to be able to acquire images into Open Dental if you are using a compatible sensor with Open Dental. If you click on the Mount and Acquire button, you can choose the mount that you're going to be placing the imaging into. Select the device and acquire, or you can create Mount and Acquire at the same time. To show you an example of this, You can also use mounts if you have images that came from a referral. Select the mount you want to use, create the mount in the system, and then you can select where you want the images to be imported to. Select Import, grab your image, open, and have it placed. If you're using the Mount and Acquire button with compatible sensors to OpenDental, it will automatically import the images as you're taking them into the mounts. The last module in OpenDental is our Manage module, where you can manage your practice. You can send your batches of claims from the Send Claims button. Batch insurance is for bulk insurance checks. Billing to send out your monthly or weekly statements. Deposits to create deposit slips from payments in OpenDental. Supply inventory to track inventory levels within the practice. TSI collections if you are currently using the third party. This will integrate with the TSI collection service. Tasks for inter-office communication. Backups to create your backups of the OpenDental database. Accounting. The emails to be able to see emails to your practice from inside of OpenDental. ERAs if you've signed up for electronic remittance advices through your clearinghouse. And import insurance plans if you've signed up for that service through your clearinghouse. We also have the time card feature, as well as the internal messaging system, along with the lighting buttons.
Thank you for joining us for today's webinar. If you have any additional questions, please contact our support line at 503-363-5432 or access our complete online manual at opendental.com. And make sure you're staying up to date on our latest training videos by subscribing to our channel and turning on notifications.